So I'm Dr. Dana Scott, and I'm a urologist. A urologist is a surgeon that deals with the male reproductive system and the urinary tract. So I deal with issues like prostate cancer, bladder cancer, testicular cancer, and urinary tract stones, kidney stones, bladder stones. Then I also deal with stuff like incontinence, urinary incontinence, women who leak on themselves when they cough or sneeze, or men who have urinary frequency, urgency, and they leak. At Gold Standard Urology, we try to be interactive and innovative. Interactive by having a great staff that communicates with patients and make a comfortable environment. Then we try to be innovative by incorporating technology with patient care and patient education. I try to use the latest technology for any interventions or surgeries that the patients may need. Hi, I'm Dr. Scott. I have my own practice. I'm a solo practitioner, meaning that I don't work with any other physicians, and I have my own business. And in my practice, I have two main offices, one in Linwood and one off of Wilshire downtown. And I have a third practice, which is in East LA, off of Cesar Chavez. And in that practice, I make myself available to everyone, to walk-ins, people who have insurance, no insurance, and they know that I'm there and they can come and see me. Also in my practice, I cover two hospitals. One is St. Francis, which is right across the street from my Linwood office, and the other one is Martin Luther King Hospital. Now, Martin Luther King Hospital is special to me because that's where I was born. I was born at Martin Luther King Hospital. And now we have a brand new hospital, state of the art, and I do cover that hospital. And by cover, that means I see patients who may have emergency urology problems. For example, if they can't urinate, or if there's a stone and they're writhing in pain, or if they have blood in their urine and they go to the hospital, then the ER physician may call me, or the doctor that's taking care of them in the hospital may call me. I have a good relationship with my patients. Even though I am a doctor, I try to start with more behavioral management as well as more holistic and alternative medicine choices. For example, trying to alter their diet or try to change their behavior in terms of hygiene in order to prevent infection, or to try to use other sorts of treatment options prior to starting medications. I use medications as a backup for when the behavioral management and lifestyle changes don't work. And then once medications don't work, then we can think about becoming a little bit more invasive with procedures or surgery if necessary. My patients enjoy that because a lot of times when they present to physicians' offices, medication may be the first option to treat some of their ailments. But here we try to treat more than just the ailment and treat the whole person by looking at what some of their dietary necessities are, or looking at some of their behaviors to try to change that to prevent issues from happening. For example, with kidney stones, if we can figure out what type of stones they're more prone to make, then we can maybe alter the diet to try to prevent stones from occurring. Or if they have recurrent urinary tract infections, I look at more hygiene, as well as drinking more fluids to stay hydrated and to keep flushing out the bladder. And when those things don't work, then we can resort to medicine and other sort of options. So a lot of people like to ask me, what's the difference between a urologist who deals with female issues and a gynecologist? Well, the difference is that I deal with the bladder, which is just above the vagina. So it's in the same garage, but just a different floor. And I deal with the bladder as it prolapses into the vagina. Because a lot of times when the bladder prolapses into the vagina, women will have issues such as urinary incontinence, or straining to urinate, or urinary frequency or urgency. And that's where I began treatment for those women, and that's what makes me different than a gynecologist. All right, so I have the funniest story of how I became a doctor, why I even wanted to become a doctor. My grandmother was a nursing assistant at Big County, that's what they called it, LA County Hospital, a long time ago. And I used to want to be just like her. I told her, Granny, I want to be a nurse, just like you. And then she told me, well, why not become a doctor? And at that time, I hadn't had any experience with women being doctors. So I said, well, there's no female doctors. And she said, well, you can become the first. So for the longest time, I think I was maybe about 4 or 5 years old, and then up into like elementary school, I thought I was going to be the first female doctor, and then until I met my first female doctor. So then she said, well, you can become the first black female doctor. So I hadn't met any. I grew up in Long Beach. So then I started thinking, okay, yeah, I can be the first black female doctor. So I was on a mission to do that. But then, of course, I learned that there were other black female physicians as I got older. But I had already started on that track and was very fascinated with science and math. And so I continued on that track. And that's why I became a doctor.